There's a troubling trend that I saw early in my career, back in the 90s, in the dental industry, that sort of went away, or at least maybe I wasn't looking, that I've seen bleed back in to the industry the last 3 to 5 years. And this trend will mess up your case acceptance, and it will mess up your patient retention, and it definitely does not contribute to practice growth. And I want to talk about that as well as how to fix it in this week's tip. To explain this, let me start off with a scenario. Let's say you're presenting a treatment plan to a new patient. You've just completed a thorough oral exam, done a full mouth x-ray or a pan or a cone beam, whatever you do with your new patients, and you have a pretty good handle on their chief complaint. Their treatment plan is substantial. They need 4 quads of scaling and root planing, 6 crowns, and a few smaller composites, all of which comes to a little south of $13,000, about $12,600. So your financial coordinator was able to estimate insurance benefits, and it looks like they have a yearly maximum of $1,500, and you've already used a couple $100 on the exam and the full mouth x-ray, so you have about $1,200 left in benefits towards this $13,000 treatment plan. Now, you've just met this new patient, so what do you do? 1, do you present the full treatment plan to this patient with their $11,000 copayment? Or 2, do you only present what insurance will cover? Or 3, do you present the first part of the treatment plan with the idea, maybe the perio treatment, that when they come in, you can talk to them about the next phases of treatment? Well, I'm not a dentist, but I would present option 1, meaning the full treatment plan. I'm not going to present only what insurance covers, and I'm not going to present a little bit of the treatment plan, not telling them about the rest until they come back, with the idea of sort of doing it over time so that I don't blow them out of the water. I'm just not going to do that, and that isn't how we train our clients. The reason I bring this up is early in my career, I saw that a lot. People doing options 2 and 3, only what insurance covers, or presenting a little bit, and then, presenting it over time. Then I seem to not see it for, 20 years. But then recently, in the last 3 to 5 years, especially with newer clients coming into MGE, we're seeing clients who are doing this. I was just talking to Sabri, our Deputy Chief Operating Officer, a couple weeks ago. She mentioned she had a new client that did just that. They get a new patient. They didn't want to present the treatment plan, the full thing, because they didn't want to upset them or make them want to leave, and they were a bit scared of what might happen. I had a client who just bought a new practice. They bought a second location, all right? Well, when they go into the second location, what did they find? They found that this office did only what insurance covered and left active disease unmanaged. I'm not talking about only what insurance covers, but, we make sure that at least there's no active disease, right? No, there was active disease that was just being left unmanaged and wasn't even being discussed with the patient. As a matter of fact, and look, I'm not trying to make a clinical comment on this. I'm not a doctor. This is for you to decide as far as what you think of this or what you don't. But this office had 2 full-time hygienists that this client bought, and they had done 12 scaling and root planings the whole prior year, okay? So 1 a month the prior year. So essentially what you had was, for lack of a better way of saying it, supervised neglect. So your job as the doctor is to make sure that you are, repairing a patient's or fixing a patient's health, function, and, aesthetic to whatever degree the patient agrees to do it. But you don't want to leave active disease unmanaged. You're the technician. You're the one who decides, what's best for this patient. The covenant is between you and your patient, not you and the insurance company or whatever other program that this patient is participating in. You are responsible for that patient, and that's the viewpoint that you should be taking. So at least that's my opinion, okay? So this brings us back to, why do we have doctors doing this? Why do we have them not presenting the full treatment plan or only doing what insurance covers? Well, in my mind, okay, there are 3 reasons, the 3 main reasons that I've seen. 1 is valid, the other 2 are not. First reason that I would consider to be a valid reason would be if, let's say, a patient wants veneers. Their front teeth are all chipped. And you go, okay, we can talk about veneers, but the way their bite is their lower teeth are chipping their upper teeth. So you could put veneers in there, they're going to smash them, or they need some type of an orthodontic treatment before you actually do any type of restorative treatment on those teeth or veneers. Well, that's a valid reason to not get into, well, the veneers are this, and they cost this much, and so on, okay? Because that's from your perspective as the doctor and the clinician, That's the best thing to do with this patient. In my view, again, I'm not a doctor, you have to decide this stuff for yourself. That would be really the only valid reason to not get into trying to close a patient on doing a treatment plan or a particular form of treatment. But even in that instance, you're still telling the patient, yeah, you're gonna need veneers. You're not lying to them about it or withholding that from them. You're just not getting into doing them right now because you need to fix their bite first. The main two reasons we see people do this when they shouldn't are fear and apathy. So let's start by looking at this concept of fear. Here's this new patient, you've just met them, they need an excessive amount of treatment. Maybe they don't know. Maybe they think they're in great condition, but they're really not, okay? Or maybe you've just taken over a practice, and here's a patient of record that needs an excessive amount of treatment, but you look at the way that they were handled when they were in the practice before you, and that excessive amount of treatment was not explained to the patient. So you're looking at this and going, I'm going to scare this person off and blow them out of my practice, okay? I don't want to upset them, you know, as the example I was giving you earlier. You know, we don't want to scare people away. Well, there's a couple of problems with that approach, all right? The first problem is this. Let's take a completely disrelated example. Let's say my car was making a bunch of funny noises. You know, it's got a knock, it's got a this, it's got a that, which, you know, 20-something years ago I might have been able to do something about. Now you open the hood of a car and it's just a big piece of plastic. I have no idea what I'm looking at. I don't have the equipment to fix it. But anyway, beside the point. So I want to take my car in to figure out what's wrong. Well, the mechanic looks at it and they find 5 things wrong. But they go, oh, this is gonna be expensive. So we don't wanna scare Jeff away as a customer, so we're gonna tell him about this first problem first, and then hope we fix it and hope he likes it, so that when we fix it, he comes back to fix the other problems. Or we'll tell him after we fix the first one. So let's look at both of those concepts. They fix the first thing. They go, okay, Jeff, it's all fixed. They didn't tell me about the other 4 things that are wrong. I drive off the lot, and it's still doing what it was doing before. Maybe it's not doing one of the problems it had before, but now it's still knocking. I'm gonna just drive right back in and go, you guys said you fixed this. What are they gonna say? Oh no, there was another problem we didn't wanna tell you about. Okay? Think about that for a second. That's essentially what you're doing with a patient, all right? Now, might a patient be upset when you tell them they have all types of problems? Absolutely. But I want you to really think about this for a second, because what we tend to do is zero in on or focus on the negatives, right? This is just sort of a human nature trait. If you see 20 patients in a day, between you and your hygienist, you see 20 patients in your practice a day, and 19 of them are any variation of super happy and nice to just pleasant, but there's one person who's just a complete jerk. Who is everybody talking about? They're talking about the complete jerk. We tend to just zero in on those. So maybe you had an experience or two where you presented a treatment plan to a new patient, and maybe they weren't expecting it, or maybe they were the type of patient who really shouldn't be in your practice. They're just a real negative person, because there was a percentage of people out there that probably just don't belong in your office. And they get upset with you, and they make you wrong, etc. And you go, wow, I really hated that experience. I never want that to happen again. So here's the problem. That one person was like that. So now you're gonna take that one example, that one time or 2 times or whatever, and you're going to apply that to every patient who walks in the door later. So let's say I walk in as your next patient and I have different problems that I wanna have handled, and I'm not gonna do that to you. And instead of explaining my whole problem, you sort of short cycle it. You know, we'll tell Jeff this part, then we'll tell him this part, as opposed to telling me everything I need. Well, I would tell you that me personally, I would be upset with you. You tell me, okay, I need perio, then I show up for perio, you're like, oh, by the way, you need these crowns. I go, why didn't you just tell me that the first time? Well, the reason you didn't tell me that the first time is because you were scared of what was gonna happen to me because of what happened to you once or twice. So one thing I would invite you to do, if you take a look at anything like this, maybe, you know, we've mentioned in a lot of our sales training that the doctor should discuss fees with the patient. At bare minimum, you should tell the patient how much the treatment plan is going to cost. And if you wonder why, number 1, it's your business if you're the owner doctor. And number 2, ask any of your staff, who is a patient most apt to listen to? It's you, the doctor, okay? This is just universally an agreed upon concept. You're gonna be the most listened to person in the practice. So we tell our clients, you know, give the patient the fee. And you can try this, if you don't do this now, try this with the next patient that you see. They need $4,000 worth of treatment. You get the treatment plan out. You go, Joe, this is your treatment plan, blah, blah, blah. Do you have any questions? No? Okay, good. Do you want to do this treatment plan? Yes, doctor, I do. Well, it's gonna cost you about $4,000. They may say, wow, how am I gonna pay for that? You go, well, how would you normally take care of something like this? well, I don't know, I could put it on a credit card or whatever. Or maybe they go, I need to do a payment plan. In any event, have your treatment coordinator there. This is the easy way. There's a better way of doing it, but there's just some basics. And I'll have you sit with Susie or John or whatever your treatment coordinator's name is, and you guys can work out the finances, okay? But you should mention that. But why would a doctor not do that? Because maybe they did, or they had a friend that did. And the patient just lost it because some people really have there is such a thing as a money button. If you collect money in a dental practice, you know what I'm talking about. You have a person, they're completely normal. The second you mention the fee, it's almost like they change personality. Well, that's an unpleasant experience, all right? So then you're changing, because of one person, you're changing your whole operating basis for everybody else, okay? So maybe you had a couple patients who gave you a hard time because of the treatment plan you told them that they needed. Well, I guarantee you, if you do the numbers, that is not the majority of your patient base, okay? You should still tell a person what they need, at least what I would want to see. You're the technician, you're the doctor, you're the reason. Like, if I go to you, I'm not going to you because I know what to do about my teeth. I'm going to you because you know what to do about my teeth. Okay? You're not the insurance coordinator. You're not the insurance doctor. You're supposed to do what is best for your patient. Okay? Your job is to make a healthy patient. All right? So if someone really has a hard time with that, rail against you for insisting that they become healthy, maybe they're just not a good fit for your practice. And you know what? That's okay. That's why we have things like the Dental Practice Act, which tells you how to dismiss a patient if they're not a good fit for your practice within the letter of the law. And it's a funny thing. If your purpose is to restore health, function, and aesthetic for your patient base, and your purpose is you want your patients to keep their teeth for their whole life, that's why you're there, because you know that keeping their teeth and having a good level of oral health contributes to overall systemic health and potentially a longer lifespan. If that's what you're all about, what you'll find is that the patients who come to your practice or stick with your practice are people who have a similar viewpoint, okay? And those are the patients that you want anyway, because you think that way and they think that way too to some degree, and you're a great match. So that's where that fear steps in. Don't be afraid. Tell somebody what they need. It really isn't that big of a deal. And if someone has a huge problem with it, and one little caveat I'll put in here is this. Let's say you have a patient, let's say I come see you. I'm that example I gave you earlier. I need all those crowns and fillings and scaling and root planings. It's a $13,000 treatment plan. And I come see you, and you come in for the new patient exam. Let's say I go through hygiene in your practice. You pop in for the new patient exam, and you start asking me about past dental experiences or what brought me to your office. And I tell you about how I've always taken great care of my teeth, and my last doctor said I never had anything wrong, and I just saw my last doctor 6 months ago before I moved to the state that you're in now. In other words, I have absolutely no clue that there is anything wrong. And then you go in and you start doing your exam and you go, wow, there's a lot wrong. So there's a problem. I'm clueless. You're finding all this stuff wrong. The last person I saw didn't give me any impression that there was anything wrong, because maybe they were scared the way that I'm describing it to you. So what do you do in a case like that? As a matter of fact, if you look at a lot of bad reviews, 30%, this is an estimated number, of negative dental reviews come from the treatment presentation process, like I'm describing here. Patient thought there was nothing wrong. I went to practice X for a cleaning, and the doctor told me I needed all this treatment, and don't go to this office, they're just after your money. Okay, here's what you could do, because maybe you're just shocking somebody. So let's say that's the scenario. I have all kinds of things wrong. I don't think I do. Well, as you're doing your exam, you might start asking questions. Hey, Jeff, have you ever noticed that the cusp on this tooth is missing? What's a cusp? You know, the edge of your tooth. Here, like this. Here, I'll show you in a mirror. Or here, intraoral camera, look on the screen. Do you see that? That whole cusp is missing. Run your tongue over it. Wow, I had no idea. And do you see this dark spot over here on this tooth? You know, it's almost starting to get a little soft there. Whoa, I had no idea that was going on. And when did this crown get done? Well, probably about 10 years ago. I want you to notice, you see how there's stuff getting caught under here and there's some decay? This we call that a margin. This area, this margin starting to open up here. Did you ever notice that before? No, doctor, I didn't. Well, now what you're doing is you're planting the seeds for me. I walked in, nothing's wrong. Now you're planting the seeds. There's something that might be wrong. So when you present this big old treatment plan, I'm not completely blown out of the water. You sort of foreshadowed that there are some issues. So that's the fear concept to begin with. The other concept or reason why people don't present full treatment plans, at least what I've found, is they've just become apathetic about it. And that's similar to the fear concept in that maybe you've had enough bad experiences where you've been practicing for a while, you've been beat up after having enough patients give you a hard time. They only want to do what insurance covers. You've heard that one too many times, and then you immediately apply this concept to everybody walking into your practice. They all want to do what insurance covers. Well, just remember that is not true. You don't necessarily have to change just because of a couple of people. And that's why, again, I invite you, if you're having if the way you're operating isn't what's best for your practice, right? Maybe you're not presenting full treatment, or you're not doing certain things that you feel like you should be doing because of prior experiences with a few patients, is count the number of patients that actually happened with. I remember talking to one doctor who used to tell the patient the fee and then stopped. Then I asked him why. And he said, because, patients as a general concept, not these particular patients, but patients got upset by it. And I finally said, okay, how many patients actually got upset and gave you a hard time because you gave them the fee? They thought, and it was 4. I said, okay, in that same time period you saw those 4 patients, how many other patients did you see? 5,000. Okay? So the point I'm making is, don't change just because a couple of people were a certain way. They just may not belong in your practice, okay? But the worst thing you can do is if you start to perpetuate this, you think everybody wants to do just what insurance covers, so then that's just what you start doing. That you don't even present full treatment plan anymore. You just present what insurance is going to cover. You've become apathetic about it at that point. Your career is going to be no fun. You're not going to have career fulfillment like you would have if you were keeping your integrity and doing what is best for your patient in every instance, okay? This is like that example I gave you earlier with the client who just bought a practice where that's all they did, okay? And the funny thing about that, I mentioned they'd only done 12 scaling and root plannings over the prior year, and there was managed disease that was left. So they found a lot of patients that needed perio treatment when they walked into this practice. What do you think the patient's reaction was when these new doctors, told them that they needed perio treatment? Many were thankful. Wow, I didn't know that. I'd love to fix that. It was really not a problem. You're putting this image up of what your patients are going to do or your new patients are going to do, and it's not always the truth. In many cases, it's false. Most people were appreciative. Most people were happy to hear it. Some did ask, why didn't the last doctor tell me that? And what are you going to say? But I don't know. This is what I'm finding, okay? So the point being is, your patients aren't going to bite, all right? You have to be you. You have to do what is best for your patients. You have to enjoy your life and your career. Tell people what they need. Okay? And if you have issues with this is why companies like us exist. As a matter of fact, one of our premier services, so to speak, this is my shameless plug here, I'm going to do it, is called the MGE Communications and Sales Seminars for the Professional. It's 3 3-day seminars where we actually teach clients how to communicate effectively with their patients, okay? How to deal with these types of conversations so that they don't get caught flat-footed, handle objections, things along those lines, as well as how to make patients want the treatment that they actually need. I'll put a link to those services in the description below. I hope to meet you there. Anyway, try this when you go back to work. A couple of the things that I mentioned here. Tell people what they need. Also give them the fee. You'll find that you'll feel better. You might even see that things start to go a little bit better in your practice. And the outcome of this is if more patients are doing the treatment that they need, right, you're going to have healthier patients, which is what this is all about. Anyway, that's all I have for you in this tip. I hope it helped. If you have any questions about MGE, you can find us online at mgeonline.com or call us at 800-640-1140. I also put the links to the communication and sales seminars in the description below in the video. And if you like videos like this and you want to be notified every time a new tip from MGE comes out, don't forget to subscribe and click the notifications bell so that when we do a new tip, you're one of the first people to know. See you at the next tip.